Today we're here with one of our patients demonstrating the use of our MLS Laser System. We're finding this therapy to be very helpful for people who suffer from arthritis, tendonitis, and back and neck pain. One of the nice things about this is that it's non-invasive. It can be used on pretty much anybody. The way this works is by applying light energy, or photons. Two different wavelengths of light come from the laser. There's a 808 nanometer and a 905 nanometer wavelength that both have different roles in healing. The lower frequency wavelengths are better for reducing inflammation, and the higher wavelengths are better for reducing pain. Someone said to me a couple years ago that 10 minutes of therapy under a laser is like about an hour of icing an acute or subacute injury. So getting an idea of what it does is kind of akin to using ice to reduce inflammation, and in certain cases heat to improve blood flow. So both of those things are going on. The patient really isn't feeling much of anything as the therapy is being applied. These are what some people refer to as cold lasers. So it's not the type of lasers that are used to burn off skin tissue if you're at the dermatologist. It's a totally different type of laser. We measure the amount of energy delivered at each session in millijoules. So depending on how many minutes a patient is getting therapy and what the program being delivered is, we're able to kind of measure every single time how much energy a patient is getting per body part. That person is going to typically respond very quickly with very few treatments, maybe 4 to 6 treatments. We like to deliver treatments pretty aggressively and in the acute setting, maybe 2 or 3 times a week. We're going to say once or twice a week, and those treatments are going to typically require multiple treatments in order to see a lasting effect. Typically tell people to get at least 5 and sometimes up to 10 treatments, and then stop treatment and see what the body's done. If we're targeting an elbow, we're not going to just target the point on the elbow where it hurts. We're going to also target the muscles and ligaments leading up to that elbow joint. In the case of the spine, for the lumbar spine, we may take 2 different sections because it's a big area. For the cervical spine, we can usually incorporate the entire cervical spine with one treatment area. And so we'll typically find out by asking the patient where they hurt, where the best place to apply the laser is, and then put on our glasses, have the patient put on their glasses, come over to the MLS system. The patient's now receiving laser therapy. It's going to go back and forth over that area, delivering laser energy at the 2 wavelengths to the specific area that we've reprogrammed it. So the patient isn't feeling anything. If anything, they might feel a little bit of warmth, nothing else besides that.